In this two-slide video, we're going to quickly review how to do the Rinne and Weber test. These tests can be used when your client complains of a hearing issue. They can be done by the nurse if you have a tuning fork. So we will review how to do that and interpret the results. These tests can also tell the difference between if it's a conductive hearing loss, meaning sound is not getting through that ear tunnel for some reason, or if it's sensorineural, meaning that the sound is getting through the ear, but the nerve is damaged and not able to pick it up. Let's get started. In order to perform the Rinne test, the first step is to strike the tuning fork and then place it behind the ear on the mastoid bone. You can see by the picture up in that little corner that you're putting the end of the tuning fork right on the bone behind the ear. And you're going to ask the patient to signal you when they can't hear the sound anymore. When they can't hear it, you're going to then move the tuning fork to in front of the ear and ask them if they can still hear it and signal you when they can't. At that point, you're going to record the length of time that they felt it, which is called bone, and then the length of time they heard it, which is called air. In order to interpret these results, the normal result is that air is longer than the time that they should hear it behind the ear. And we call that Rinne's positive. If they have a conductive hearing loss in that ear that they're complaining about, the bone time will either be longer or usually what they'll say is that when you put it in front of the ear, they don't hear it anymore. And then in that case, we're saying the bone is longer than the air. Or if you did do the time, the bone time would be longer than the air. In sensorineural hearing loss, air again is louder, longer than bone, but that would be considered a Rinne's false positive. It's kind of hard to tell with this test whether it's a sensorineural hearing loss. This is better for a conductive hearing loss. The Weber test is a little bit easier. In order to do the Weber test, it's only 2 steps. Strike the tuning fork and place it on top of the head, right in the middle of the head. And just simply ask them which ear they hear it best in. Do they hear it in the left ear best, the right ear best, or both equally? In order to interpret those results, a normal Weber test is that they should just hear it equally midline. If the ear is a conductive hearing loss issue, the sound will be louder in the bad ear, so it's important to remember what ear they're complaining about. If they hear it louder in that bad ear that they're complaining about, that would be the conductive hearing loss, because remember, vibrations and sound move quicker or louder through solid versus air. And then sensorineural, if the sound is heard louder in the good ear, that would probably be a sensorineural loss in the ear they're complaining about. Thank you for joining us on this short video about the Weber and Rinne test. If you like this content, subscribe to our channel, and you can also find us at signstrategies.com.